FILIPINARS listeners and followers. I hope you all had a happy Valentine's Day and celebrated the day with your loved ones. And as you know, FILIPINARS is brought to you by the PNANV, or the Philippine Nurses Association of Nevada, in collaboration with PHLV Radio. FILIPINARS video episodes can be accessed via PHLB Radio Facebook and other social media platforms like YouTube, Facebook, Amazon Fire TV, and soon to be streaming on Philam TV. Thank you for joining us today. Well, 2 years ago, the PNANV and other nursing organizations made a trip to Carson City, Nevada, to meet with the legislatures in the hope of passing a bill for the Nevada Nurse Licensure Compact. Well, that trip did not give a positive outcome. So here we are in 2025, and nurses, being the resilient people that we are, well, we're here to try again, right? So this is our topic for today. We have invited the NNA, or the Nevada Nurses Association, to our program today. So please welcome Ms. Diane McGinnis, Ms. Starla Gallagher, Dr. Victoria Squire, NNA lobbyist Zoe Houghton, and Charlie De La Paz. Well, Diane, where are you calling from? Are you from Reno?
I am not from Reno. I am actually from Las Vegas, and I've lived there since 1987. But I am currently up in Alaska doing a locum tenens assignment.
Ah, so you're calling from Alaska. All right. And what about you, Starla? You're calling from Reno?
I'm not. I'm actually visiting Arizona right now, but I'm from the little tiny town of Beatty, which is just about an hour and a half, 2 hours north of Las Vegas.
Oh, my goodness. And Charlie, where are you calling from?
Hi, I am calling from Carson City. So I live up here so that I'm really close to the capital. And I'm actually a lifelong resident of Las Vegas.
Oh, my goodness. Well, okay. And what about you, Zoe?
I am in Carson City right now, but I am born and raised in Sparks, Nevada.
All right. Well, okay. So I'm the only one here in Vegas. All right. Well, welcome, everybody. Thank you for joining us today. So let's start with possibly maybe Diane. Diane, Diane is the executive, no, she is the vice president of the NNA, correct, Diane?
Correct. I'm the vice president of NNA and then the legislative committee chair.
Okay. All right. And let's see. Starla is the executive director, and Charlie and Zoe are lobbyists. And when Dr. Squire can join us, she is the president of District 1 of the NNA, correct? Okay, great. So let's start with Ms. Diane. Can you tell us a little bit about the NNA and what is it all about? What is the organization's mission and vision?
So NNA stands for Nevada Nurses Association. And actually, I believe that Starla has the mission pulled up. She's our executive director. So I'm going to let her move forward with the mission.
So the mission of the Nevada Nurses Association is actually to promote nursing practice through continuing education, community service, nursing leadership, and legislative activities, which is, of course, why we're here. We strive to advocate for improved health and high-quality health care for the citizens of Nevada.
Very good. And so so how is the NNA divided leadership-wise? Is it by districts then?
I'll go ahead and answer that as well. So we actually have two districts in the state. The first is the Northern District, which is District 1, which is Dr. Squire. That's her district. We also have District 3. Don't ask me why there's not a District 2. I don't know why, but District 3 is the Southern District. And then we have our state board as well. And all three have their own separate individual boards, and then they kind of all report to the state overall board.
Okay, very good. Thanks for clarifying. What are the activities of the NNA, and what benefits would the nurses have if they would join NNA?
I'll start, and then we'll let Starla add in.
Okay.
The Nevada Nurses Association, we consider ourselves an umbrella organization. So we represent all nurses in Nevada, whether they belong to a specialty group, if they work in a nursing home, if they do home health care, if they're an entrepreneur, and the nurses that work in the hospitals, as well as, God bless you, Carla, as well as any other places that nurses can work. As you know, nurses are very resilient, but they're also able to be very flexible and work in a variety of different areas that some people do not even expect, such as public health and even working as school nurses. So we consider ourselves the umbrella organization. We represent all nurses in Nevada, including nurse practitioners, nurse midwives, nurse anesthetists. So all nurses are represented by NNA.
By NNA. Okay, very good. Very good. So let us talk about the topic for today. Who can tell us what a nurse licensure compact is, and what is the NNA's involvement in this current campaign?
I can do that.
Okay.
So basically, as the NNA, we are involved in that ongoing conversation that we know has been going on for, at least a decade here in the state of Nevada, as we are one of the last to take part in passing some kind of compact language for our nurses. So we have gone about this in different ways each session. However, this session, it was produced a little bit differently than we have seen in the past, and that was more in an omnibus style compact. So there are other professions that have been included in this compact, and the nursing profession is one of those. We are one of the last states to do this, so we really, really would like to get this passed, but we face great challenges here that have stopped us from being able to do so. But we will continue to learn more about this, to fight this, to do everything that we can, have those conversations, and to coalesce with other groups that would support that as well, like other nursing organizations, so that we can get this done. Hopefully this session, as we only meet for 120 days, so we have to be very quick about it. But we are very engrossed in all conversations brought to the table, to many of those representing NNA, and so far we have had some really good conversations this session. So.
Well, very good. Thank you for that. And yes, statistics show that there are 43 states that are in nurse compact licensure. So we are one of the last 7, Nevada is, that are not within the nurse licensure compact. Is that correct?
Yes, that's about right. It's really difficult here. And as you know, we really struggle with a couple things, and the nurse licensure compact would solve that, which is obviously that we have a lot of barriers when it comes to licensure, and it's very difficult and onerous, and it's a lengthy process. And so we believe that obviously that would be one of the aspects that would help us if we could get this passed, but and removing those licensing barriers. But then also we need to retain nurses in this state. We need to keep educating them, retaining them, and also we believe that this would enhance the public, enhance the protection of our public in healthcare. Nurses are incredibly important and are the number one caretakers of our patients. And so we really obviously support this and hope that we can get a little further this session on it.
Very good. Thank you so much for that, Charlie. So recently, the Nevada State Board of Nursing sent out a survey regarding the nurses' opposition or agreement to the NLC. And can you speak about the results of the survey? Perhaps,
Yeah, I'm going to turn that one over to Zoe or Diane, for that.
Actually, I say let's have Dr. McGinnis talk on that one.
Okay.
Yeah.
So the survey, and I don't have it pulled up, so forgive me for not having the exact numbers. Maybe if we could get
Yeah,
that
I think
over
I
to
got it
Doris, so
pulled
she
up.
would be able to pull that up, that'd be great. Still shows after 3 times doing the same survey that the majority of nurses in Nevada are in favor of having the nursing compact, including the majority of union nurses. The big tell about this is how many nurses have participated in it. With any surveys or any research, we always look at what's called the N number. And the N number is how many people responded. And usually it's very low. This survey every year has had a very high number of people responding. And this year was no different. There were over 10,000 nurses that responded to the survey, I believe. I don't have the exact number, but it was close to 10,000 nurses. And that's a huge N number. That means we've got a pretty good ability to take the results of the survey and spread it out to all the other nurses. And that's kind of how research works. And many of you are probably research nurses, PhD nurses, etc. And so, understanding research really helps with what's going on with the results of the research. I just wanted to add a little bit more to what Charlie said about the Nurse Licensure Compact as well. The Nurse Licensure Compact gets people's emotions all involved. And in reality, I've used this analogy before, and it's really a true analogy. Almost every nurse in Nevada belongs to one of the largest compacts in the nation. We almost all have driver's licenses. And the driver's license is a compact. Each state runs their own division of driving. DMV is what we call it in Nevada. Mm-hmm. And each state gives a Nevada-specific or a California-specific or a Virginia-specific driver's license. But with the driver's license compact, you're allowed to drive in other states whenever you want to. You just drive to the other state. When you're in that state, though, you have to follow their laws. So there's certain states that have certain laws. Michigan has a U-turn law. Ohio has a U-turn law. So as long as you follow their laws while you're there in your state, you can use your driver's license in that state. And in reality, that is all that the Nurse Licensure Compact is.
Right.
It's the ability for nurses to work across borders, to not be tied to a single state. And really all that we're asking for. I'm licensed in 5 different states. And so every year I have to keep track of separate expiration dates. I have to keep track of separate CEUs for each state. Mm-hmm. And so the compact allows us to just use our single state, which is Nevada, our Nevada license to work in other states, or for other nurses that maybe are licensed in Florida or New York or Hawaii, to come work in Nevada without having to apply for a separate license. And it's really just as simple as that. We already have a huge compact, the driver's license compact, and we just want to have the nursing compact.
And thank you for doing that. You are so right. I don't know what the difference would be. You have to abide by the laws of the state where you're in, right? Whether it's driving or whether it's in the nursing profession, right? Okay.
You're correct, Doris. That is exactly right.
Yes. And I'll give you some numbers on the survey here. 12,438 nurses have completed the survey that was sent out by the Nevada State Board of Nursing in collaboration with the National Council of State Boards of Nursing. Out of those, 92% of the responders hold an RN license. 96% of the responders reported practicing nursing in the past 24 months, and only 18% of the respondents said that they were union members. So it was highly rated. A lot of it, what is it? I can't find the. Do you know about this, Carla? What was the percentage of respondents that favored the survey, the NLC?
It was 92%. Is what the
I was going to say, I thought it was somewhere. Yep.
What was that?
Go ahead, Zoe.
Sorry, we overspoke. 92% of those who responded to the survey in 2022 that was sent out by the Board of Nursing supported enacting the Nurse Licensure Compact.
Okay. For the 2025, though, let's see.
I believe
No,
they
it's
said it was.
95%. Yeah,
I think they said 95 for this
yeah,
one.
95% of the respondents were in favor. Oh, and Dr. Squire has joined us. Hi, Victoria. You're unmute. Okay. Well, did you get that person unlocked from the sim lab?
Thank you.
Okay. All right. Well, let's thank you for joining. We appreciate you. So, okay. Let's see. So there is a current Senate bill called SB 34, which is an act relating to healthcare entering into interstate compacts that authorize the multi-state practice of certain providers of healthcare under certain conditions. Now, this bill was authored by Joseph Filippi, who is the executive director of the Patient Protection Commission of Governor Lombardo's office. Can you speak about this, and what are the other healthcare professionals that are involved in this compact licensure bill?
Hi, Doris. This is Diane.
Hi, Dan.
In case people are listening to radio or driving while they're
Okay.
on the podcast. So the Senate Bill 34, and it is currently in the Committee on Commerce and Labor, and as you said, on behalf of the Patient Protection Commission, is taking current law and then adding some changes to it. And specifically, they're including physician assistants, physical therapy, occupational therapy, and I am missing one of the
Audiologist, I think.
specialties. I'm sorry, who was it, Zoe?
Audiologists, I believe.
Audiologist.
Yeah.
And then, yes, audiology, speech language pathology, as well as nursing. And these are all great specialties. And somebody brought it to my attention. They were kind of looking at those specialties and saying, those of us that are old nurses, we did all that. And so specialties have broken off from what nursing used to do. And we used to do all those things, and we still can do all of those things
Right.
as part of our nursing. So I feel that it's very appropriate that we are included with that group. Of course, we are not physician assistants, but we do have many APRNs in the state. And so you have that ability to represent physician assistants. And they are sometimes called physician associates now, or PAs as well. And I'm noticing a little lag time from what I'm saying, so I apologize for the slow internet out here.
That's okay. And a couple of days ago, we actually initiated like a meeting, which was a collaboration between the Nevada Action Coalition and the PNANV. And Starla, you were there. Could you possibly talk about, because I know Joseph Filippi was there, can you talk about what he said during the meeting regarding the bill?
Basically, with regards to the entire thing, it's a collaboration. So by including all of us, it's going to bring everybody together as one unified group. And hopefully having multiple voices will help to keep anybody from being separated out or declined, as far as, because what typically happens for us is we have very strong, I hate to say unions, but unions that come and push against us. And because of that, they a lot of times get to bring in things like safe staffing, and they kind of confuse and muddle what the NLC actually is about. So by all of these different groups coming together and it having a common source as far as the information and the push, it should be a lot stronger going forward. And Zoe, I know you weren't there at that meeting, but what are your thoughts on how this is, coming together?
Yeah, so with it being an omnibus bill, I think that changes a lot of things in the sense that there are a lot more stakeholders. I think there's also something to note that there are multiple compacts, not just this omnibus compact, that are trying to be passed this session. There's one for counseling, there's one for interstate fire compacts. The recognition that compacts are helping our state, especially in improving healthcare access, is acknowledged, and there is that appetite has still remained and sustained, I think, as evidenced by the 2025 survey going from even increasing more in the amount of nurses who support it. There's also it coming from the PPC shows that with it being housed in the governor's office, the executive branch, and the PPC's sole purpose is to increase healthcare access to Nevada, it certainly shows that it's more of a broad understanding that this does help the entire state. It's not just, a nurse's benefit. It's trying to, there's a giant puzzle, and we need to holistically look at what healthcare access looks like in our state. And there are more compacts looking to be passed this session right now as well.
Well, yeah, that's good. So you think there would be I am praying for it, actually. Is there an advantage of this bill as opposed to AB 108 from 2 years ago when the only professionals that were involved in the bill was nursing? You think so?
Yes, there are definitely some more advantages, and there's definitely a different political scheme that we're dealing with in this legislature. Back when AB 108 was attempted to being passed, the Democrats held a supermajority in the assembly, meaning they really didn't have to talk to the other side at all. They had the 2/3. They had everything they really needed to get everything passed out of their house. This time around, Democrats lost a couple seats. They do not have the 2/3. It's the same in the Senate, as there's still a 12-9 makeup of legislators, and this being housed in the Senate side is good as well. With it being in Commerce and Labor, we have a chair, Julie Pazina, who's a newer chair to Commerce and Labor, and serving in her second term of her full Senate term. So the differences of who's really at play and who's going to have a say in this is starkly different, and both sides must talk to each other. There's also the advantage of the governor and the 2026 election. As we saw in 2024, Nevada went red in a lot of ways, and the Republicans do have a lot more say in our political sphere, especially in the legislature this session. With Governor Lombardo saying that one of his priorities is to streamline all of government and make it more efficient, including in our healthcare divisions and departments, there's a lot more of a concerted effort at the holistic, larger level of making sure that our boards and commissions and everything functions smoothly, and that includes licensure. And that's why all these licensure compacts are being looked at across a multitude of professions.
Very good. Very good. Thank you. And I wish that the governor could do an executive order on this, but I guess he can't because it involves some kind of licensure for professionals, right?
Yes, it is. It is statute, and the way we have everything written out, the legislature is our lawmaking entities. So it is up to those 63 in there.
Okay, very good, very good. So maybe Dr. Squire, you can do this. Do you have any FAQs, frequently asked questions about the NLC?
Currently, I have one question on the table regarding the 60-day notification of if you're in a compact state when you initially received your multi-state license. If you were to move to another multi-state licensure area, you still had to declare your residency unless you were considering it a secondary residency.
Right.
So the concern was the nurse would be paying a fee in every move if that move was made during the licensure's renewal or mid-renewal. So I guess each state may not have consistency in how they ask for application fees, despite the 60-day notification.
Okay.
I actually have an answer to that, Doris.
I'm sorry, what?
I actually have an answer to that.
Oh, good, Diane. Yeah, sorry. I couldn't hear you.
That's okay.
Go ahead.
That's all right. So the answer to that is it's the same as a driver's license.
Yeah.
If you move to a new state and declare residency in a new state, you pay the new state for the driver's license, whether you're mid-driver's license or not, and it runs right back to the first analogy. This is just the ability to move from state to state. And in most states, the driver's license, when you move, you only have 30 days to change your license. And with the Nurse Licensure Compact, it's the state that you declare your residency in. So it's the state you're going to file your state income taxes in, the state you're going to file your federal income taxes in. So if you are moving, then you need to file for the new state. If you're like me and you're working locums in Alaska, while I've spent more than half of the days of the year in Alaska this year, I still live in Las Vegas. So Nevada would still be my primary state, and it would be the state where I would pay for my primary license.
Right.
So it depends on where you declare your actual residency at.
Right, that's correct. It's kind of like me also. I do have a license in Arizona and here in Nevada, but because my primary residence is Las Vegas, this is, well, I have a license, but I cannot be a resident of Arizona, therefore I cannot apply for the compact licensure, which Arizona is already under, because of the fact that Nevada is not part of the compact, right?
That is correct, Doris. And the important part to understand about that is that Nevada currently has a single state license.
Right.
Meaning we have to be licensed in Nevada. I have to pay for a separate license for my Florida, a separate license for Alaska, a separate one for Washington, a separate one from Idaho. Even though 3 of those 5 states are in the compact, because Nevada is my residence. With the new compact, nurses have the option to just continue with the single state license. They can keep just their Nevada license. They do not have to apply for a compact license. It is a separate license, and I can use Washington State as an example. They just passed this in 2 years ago. They passed it like 2 days before we asked for ours to pass, but it did not seem to have any strength with our legislators to know that another state had just passed it as well. So Washington is still rolling out the compact licensing. So I just renewed my Washington license, and I still have to buy a single state license in Washington.
Right.
But when I applied, they gave me the option of, would you like to say that you want to work in Washington with a multi-state license, and then you only pay the multi-state license fee. So each state will still have a fee for the different licenses. It doesn't necessarily eliminate the fee for the host state, if you want to call it your host state or your resident state. And so for your host state, they will still get the fees, but you will be able to work in the other states without paying the fees, exactly the same as a driver's license. I only pay Nevada for my driver's license, but I can drive in every state, including Alaska, with my Nevada driver's license.
All right. Well, yes, that's very good. That's a very good insight, and thank you so much for that. Are there any more frequently asked questions about the NLC that you're aware of? Anyone else?
I know one that we get a lot is whether or not they can be disciplined in multiple states with the nurse license, nurse licensure compact. So, Diane, can you maybe speak to that?
I can. Sorry, my mouse didn't want to move over to the mute button. So, currently, if you're a nurse who practices in separate states besides Nevada, you're familiar with a system called NurseSys, NURSYS. And often when you apply for a job or other place, they ask you to look at NurseSys and send them a copy of your license. We used to hold cards, and most of us are older nurses on here, that we used to have a card, just like a driver's license, for our nursing license.
Right.
And now everything is basically done electronically. And so with NurseSys, the states have a very short amount of time to report any discipline to that system, which then goes out to each of the other states that that nurse has a license in. So we currently already have a multi-state issue. With the compact, it's the home state, so in this case it would be Nevada, who would be in charge of the discipline. However, that discipline then rolls out to every other state. And guess what? That is no different than the current system that we already have. We already have that exact system. Nevada is in charge of disciplining nurses in Nevada, and it rolls out to all the other states.
Okay, that's great. Thanks for clarifying that. Anything else?
I think the last one that I get a lot is with regards to CEUs. There seems to be an assumption that because the CEU requirements across the various states are not exactly the same, that nurses coming into our state would be less educated, less well-rounded, whatever you want to say that as. And so people are concerned that it's going to diminish quality of care.
Yeah, and let's segue this question to that, to what you just said, Sarla. What are the major reasons for opposition for the NLC? And is there a major organizational entity that is basically opposed to the NLC? Starla or Charlie or Zoe?
Charlie, please.
Well, I would say that unfortunately the entity that opposes it the most would be the union. There have been many conversations that are completely separate from conversations that we're having, and that is one of the biggest problems that we're seeing. And so that, coupled with the exact thing that Starla just said, is mostly what we hear and why that they're in opposition to it. And if Zoe wants to add to any of that, I know that we've got some data on that as well.
Okay.
Yeah, the main opposition often comes from two main unions called National Nurses Organizing Union and SEIU 1107. They are still very active in this discussion, and as well as other nursing bills that are coming through the legislature, but their main opposition to it had to do with their arguments being that it would undermine collective bargaining. It posed patient safety risks by arguing that it would be less stringent licensing requirements, and then also that it would affect our state sovereignty in terms of Nevada's ability to regulate our nurses independently. And we kind of know that, and nurse retention as well, but as we know that, as Diane mentioned this in her arguments, that it's like a driver's license, all this stuff. Nurses still will be able to, the Board of Nursing still will be able to regulate and reprimand any nurse who violates our laws and everything. But these are the arguments that they have said and they will say, and they've said at other public meetings that mainly it's a staff safety issue is a big reason why we don't have nurses in Nevada versus them actually being able to come here and get licensed. But they've said a lot, including that we don't even have a nursing shortage in Nevada, which I think we all know is quite false.
That's one of the major things that we're hearing, is that they are saying that there is actually no nursing shortage here in our state. I mean, what do you think of that, ladies?
Personally, I found it I was truly stunned when I listened to them say that on the public meeting regarding SB 34. We know that we have anywhere between 5,000 to 9,000 nurses that we need in this state. We also know that hospitals are, spending thousands and thousands of dollars paying all these traveling nurses to deal with this, and it still is not fixing our healthcare shortage issue. So obviously there's some disconnect between what they're saying and what's really happening on the ground.
Yeah, and I want to add to that many of us here are from Nevada or have been here for 20 plus years, and it is palpable among all residents. This is not a winning argument for them. It is, we all know, even if you're a mother, you're a caretaker of some sort, or, have any kind of health issues that you're dealing with on your own, it's obvious that there is a major healthcare shortage of nurses, doctors, and all of this. And I want to say that when the physicians did get their compact in the past, that the healthcare provider actually for physicians actually went up about 64% in the state since they passed their licensure compact. There is truly no evidence out there to say that any of their arguments are even valid, and are pretty weak, unfortunately, because they are unions. They hold a lot of power, and that's what's winning here. That is why we need to really focus on the education of our nurses. We need to really focus on membership in our association, and really concentrating on the fact that we need to retain nurses, and this is the way to do it. We're already accepting traveling nurses.
Right.
That is sort of a halfway compact in and of itself.
Yeah, correct.
And we have to do that in order to fulfill all of these shortages that we have. So it is such a blatant lie and thing to say that. It's pretty laughable, and actually a slap in the face to all Nevadans and all the hardworking nurses that give so much while they're here to give care. So all of this will actually rise all tides, right? We have
Right.
to have these things in place. We've got to have the compact in place.
That is correct. And thank you, Charlie, for that. Now, 2 years ago, we tried to engage the union to have discussions with them as to what the reasons are for the opposition. And they never responded to our invitation. So I'll keep on trying, and I'll let you know if they do have to come to the podcast or some kind of a meeting with you guys and saying, hey, this is why we're opposed, and we can just have a debate about it. What do you think? Diane, you up for that?
I am up for that, Doris, and thank you for saying that. I believe that one of the things that can come from this podcast is that the nurses that are listening to this compact conversation, hopefully they understand what we're asking for, and hopefully they can put pressure from inside as members of the union to tell the union, hey, I am a member of you and I disagree with your position. I want you to tell me, as your member, why you're not representing my thoughts and my feelings and what I want. Why are you representing someone else? And so I think that's something that could come out positive from this podcast.
Well, we are hoping that they will accept our invitation again. We're going to try again. But the only thing we can do is try and to disseminate the information on why this is important to all of us, right? So let's see. So what will the NNA be doing to get the interest and engagement from the nursing community to help in the passage of this bill?
All right, I'm going to jump in on this one.
Loaded question.
We have a lot of stuff that we are working on right now. As you can see, we do have lobbyists that are there in Carson City advocating on, I hate to say, the front line, right? But they are there on our behalf to make sure that these conversations are happening. In addition to that, NNA always hosts a Nurses Day at the legislature, and this year will be no different. That'll be on May 20th, 2025, so I hope all of you will join us. There is a small fee, and that's going to be just for kind of shirts and such to unify us as a group. Last session, something that kind of stood out to us was that the union showed up all in the same shirts. They showed up with the same, big logos and signs and all the things. And it was very hard to not notice them compared to the nurses that were in the room. So we're going to try and make our presence a little bit louder. But in addition to that, we're having this at the same time as our conference. So we're going to have 2 days of educational opportunity with also CEUs online. So for instance, those that are just participating in Nurses Day at the legislature, we have our lobbyists working on a CEU credit that will help them to understand how to speak to our legislators, what things to say, what things are not good to say, how to keep their conversations brief but impactful, just all that kind of stuff that's really important for them when they come in person. We're also organizing meet and greets for different individuals based on where they're at. Our lobbyists are in the process of pulling statistics so that if there is a representative that is specifically against the compact, we have the ability to go to, say, the 50 nurses or something that are in that area and say, hey, write your legislator, get in their face, tell them that this is something that you want, go and be the voice for that area. So we're really trying to make it so that this year we have a lot more say and a lot more presence, because in the past, it's kind of been, we're there, but we're kind of not there. They don't really know who we are once we show up. So this year, the goal is to be as loud and obnoxious as we basically can be, so that they actually hear us and can't ignore us. So we would like to invite you all to that. If you go to our website, it's NV for Nevada Nurses with an S at the end, .org. Again, nvnurses.org. You'll find, it'll say NNA Conference and Nurses Day at the Legislature. You can click on that and you'll see registration for just the conference, registration for just Indall, and then registration for the hotel rooms, because we have secured the federal hotel and they are actually blocking out all of their hotel rooms with the hope that we can fill them all for participation. In past sessions, we've had a cap on the number of nurses that could participate, with 100 being our number because of space. And this year we're doing things differently so that we can have as many as possible there. So there's no longer a cap. So the goal is to fill the federal hotel, fill the lobbies, fill the offices, fill both the Senate and the Assembly, benches and meeting spaces, and then also get some of us on tours for the Capitol just for fun. So that's what we're hoping to do, and just mostly be really obnoxious and in their face. They can't miss us. So.
Oh gosh, thank you, Starla. I was there 2 years ago, and yeah, we were there, but I wasn't obnoxious. So I guess. All right, Zoe or Charlie, do you have anything to add to that? What are we doing on top of what Starla has said?
Yeah, so thank you for that. And because we'll be doing that course for the nurses beforehand to teach them how to be effective in the legislature, that's the one thing that is incredibly important. We're going to be obnoxious and in their face in the nicest and most respectful way, so that we are very effective, and she knows that. But we, on top of that, we are going to have sponsor tables there for anyone who supports a compact, any other entities that want to come and support in the name of bringing more nurses here, but also have anything to do with the industry of healthcare. So we're having them come along. We're going to have food for everyone, events. At the end of the day, it's going to be a very long day. So, buckle down and make sure that you're ready, because it will be eventful and it'll be a lot of fun. At 5 or 5:30, we have a legislative reception, and that will be for anyone who wants to join, who comes up for this specific day, or even the legislators or other lobbyists who have an interest in this compact will be invited to come and join us to be supportive there as well. And we also get to have our certain nurses on the floor, and that's such a great, wonderful opportunity. And other than that, we'll be a very organized group going around and speaking to the legislators that we hope to influence and to bring this important issue to. And we also have set up some, various tours around the compound. So, the library, the other museums that are around, and so nurses can take part in those as well. So it's going to be a really fun day, and with a lot of camaraderie. And we just hope that we have a really good turnout so that we can be influential.
Very good, very good. Zoe?
And just wanted to add, yes, the Nurses Day is great. Our overarching theme is that nurses are Nevada's healthcare, and us showing up in those large numbers will show that. I think another thing that we can do is, as well, where as we're in the building having these conversations with people, is you as nurses, before we even engage physically in person, you can go leave a public opinion on this bill, SB 34, and you can have it say support. And honestly, I'd really love it if if all those 95% of nurses came in and gave their public opinion, and you can see the reports on all the bills for the session. And I want SB 34 to be top smack and saying it has over 1,000 people support and only a little bit opposition, because there is the numbers there. And as As we know, we've been fighting this for 20 years for political reasons, but the support is to show that the support is sustained and always there. And there's always these little things that you can do, as we said, that when you find your legislator, etc., let them know how important it is to you in the meantime.
And I want to add a little bit more to that also, is that the work that that the lobbyists do, the work that Zoe and I do behind the scenes is also very important. So we take that time to have very important conversations, and this has already been going on for over a year. We prepare way in advance to have these meetings and conversations, and that is ongoing. Also, like we've spoken about earlier, it's coalescing with other entities that this is important to, and building a strong network. That's why it is incredibly important to have people join the association, but we also keep everyone apprised of the latest and breaking news, and that's really why it's important, and we help you stay engaged. So we're extremely engaged in this. I think Zoe and I have been eating and drinking and sleeping this topic for months and months and months now. And so that is what we're doing on our end.
Very good. Well, thank you for that. And we did have, with the discussions, the meeting that we had a couple of days ago, we have engaged other organizations as well, to participate in this. And I think that's what we can do as nurses at this point, is to engage our legislators, especially those who we're voting for in our particular district that are in the list of those who we need to call. So is there anything else you need to add to that? What can we do as nurses right now? I think we covered everything, right?
I did want to share one more thing. Oh, go ahead, Naomi.
Oh, go ahead, Starla.
Sorry, Dr. McGinnis.
Go ahead.
That's okay. So I will start, and then I'll let Starla close it out.
Okay.
I think that in answer to your question, Doris, it's very important that you participate as a nurse.
Yeah.
That you join the Philippine Nurses Association, that you join our umbrella organization, the Nevada Nurses Association. We strive to represent all nurses in all groups. And we just want to make sure that everybody understands that the more participation you have in, the more you work with different nursing groups, the stronger we are as nurses. And Starla, you had a comment as well?
Nope, that's what I was going to say, was get out there and participate. Make sure you're sharing the information. All of us have connections to different people in different ways. And so when you get an opportunity, just share what these things are. And that way, the more people that show up, the bigger the voice is. So
strength in numbers.
That's
right?
exactly what I was going to say.
This podcast, when it airs, we let's share it. I know in the meeting that we had the Black Nurses Association, we had the AAPI-NA, which is the Asian American Pacific Islander Nursing Association. We had representatives from the Nevada Action Coalition, from the FAPERNA, which is the Filipino American, advanced practice registered nurses, and some other people. So we are going to be engaging these people at this point. So I do appreciate, everything that you guys had said. So in closing, what is your message to the healthcare community and the public? How about we start with you?
I'll step on that one as well.
Go ahead, Diane, you go for it.
Thank you. As the chair of the Nevada Nurses Association Legislative Committee, my message that I want to get out to the nursing community is we need to see your faces. We need to hear your opinions. We need you to be our arms, our hands, our fingers, our virtual nurses, per se, for this, to see if we can try to fix this poor, sick patient. This patient that just needs a driver's license to be able to go from state to state.
Okay, very good. Anyone else who has a message to the public and the nursing community? Dr. Squire?
My message would be to really think about our next generation of nurses. They want to be out there. They want to travel. They want to explore this country, and it's not going to keep them from doing that. So why not take advantage of having the compact licensure for this state so that they can still keep Nevada as their home and continue to explore and be of service to everyone in the community of healthcare.
Well, thank you, Dr. Esquire. And for all of you who don't know, Dr. Esquire is also a board member of the PNANB, right? Just throwing it out there. But anyway, is there anyone else who needs to add a message? Starla, you're done?
I guess just I would say make your voice heard, in whichever way that is possible, whether it's through participation or writing letters or being there for Indall or joining your association, whichever way is best for you. Just make sure that your voice is heard and that you're there. You don't want to get past this and feel like you should or could have. Just decide now that you're going to be a part of the change and try and make that difference.
Right. And if there's anybody who wants to know more about the NLC and what activities they are, they need to go to the NNA website, or is there a particular link that you want to share?
You can just go to the nvnurses.org, and I can actually send you a couple other links as well that maybe, I don't know if you guys can link them to this or not, but I'll send you a few things so that you guys can look at those. But all of our conference and Nurses Day at the Legislature information is on our main website, so you can get that. And then also you can explore and see all of our CEU options, see what your benefits would be as a member, all those fun things. So that's the best place to go, nvnurses.org.
nvnurses.org. I think we have it on screen. So, okay. Well, thank you very much to all of you. Dr. Dan McGinnis, Ms. Starla Gallagher, Dr. Victoria Squire, Zoe Houghton, and Charlie De La Paz for coming today to our program to talk about the NLC and strategies on how we can get this compact licensure passed, right? So thank you so much, ladies. Appreciate it. And to our listeners and followers. Sorry, go ahead. Oh, yes, absolutely. Anytime you want something disseminated, let us know and we'll get you on the air. Okay, thank you again, ladies.
I apologize for interrupting. It's that leg from being out here in the rural area.
Okay. Thank you. All right, and to our listeners and followers, we leave you with this. According to the statistics out there, we have about 4,000 vacant nursing positions in the state of Nevada. And Nevada is ranked number 45 in the nation of the availability of nurses to work and serve the public. The Nurse Licensure Compact, or the NLC, is an agreement that allows registered nurses, or RNs, and licensed practical or vocational nurses, the LPNs or the LVNs, to practice in multiple states with a single multi-state license. So this compact increases access to care while maintaining public protection in the state level, enabling nurses to work in all compact states without needing additional licenses or background checks. The NLC simplifies the process for nurses to provide care across state lines, enhancing workforce mobility and flexibility in healthcare delivery. Please think about it, and we would love to have you on our campaign to vote for it. Thank you very much for joining us today. Please be well and be safe. Until next time, this is Doris Bauer, your FILIPINARS host, signing off for now.
This is your Filipino radio experience in Las Vegas. PHLV Radio.